Healthcare is sort of the poster child of corporate control of public policy. I should get my notes. And unarguably we don't have a healthcare system. We've got a sick care non-system. And all of the rest of the developed countries of the world start this healthcare discussion with access to reasonable, cost-effective healthcare is a human right, and therefore it's a legitimate function of government to make sure everybody gets it. And then they design a system to reflect those basic principles. And what's worse is if it's a 10-story factory, the top 2 stories, 20% of all of the resources are spent basically paying people to fight over money. Insurance companies and billing companies and all the resources and it doesn't contribute to anything to the product, which is supposed to be health. To get an idea of corporate influence on healthcare, we can only look at this sort of process of healthcare reform that happened during the great healthcare reform debate of 2009. And the government was going to have all these hearings, and they were going to put everything on the table, every option on the table. And President Obama, as a senator, said single payer is the only solution to this mess. And so they held all these hearings, and everybody remember about Senator Baucus, the Health Finance Committee hearings? Well, everybody was invited to the table except anybody that advocated for anything that resembled a single-payer solution. What we do really good in this country is we divide the country up into risk pools, because historically people got their insurance in the workplace, and the workplace would get group policies. And so what we've got in this country is, if you look at the risk pools we've got Medicare as an identifiable risk pool, and Medicaid as an identifiable risk pool, and the vets is an identifiable risk pool, and then you've got the working people who are kind of their own multi-risk pool, but you can think of them as a lump sum. And what we have is that Medicare, which is old people, is a really expensive risk pool. Okay, we're all paying for everybody anyway. Let's create one giant risk pool and pay for it with taxpayer dollars. That's single payer without using the term single payer, and it's much less loaded. So I like to think of single risk pool, taxpayer support. Okay. So getting back to this concept of corporations, the reason we're not able to fix our healthcare system is that Congress won't let us. Because Congress is, if nothing else, as we all know, the way you get reelected in Congress is you raise money. The way you raise money is you get corporate money. And so Congress is getting in the way of us fixing health care.